Welcome back to Good Day NWA. May 8th is World Ovarian Cancer Day, and I am joined by Dr. Scott Bailey here at Park Hill, the clinic for women, empowering women about their risk and bringing awareness to ovarian cancer. Dr. Bailey, thank you so much for sitting down and chatting with me.
Oh, it's a pleasure to be here. Glad to pass on a little information.
So something about ovarian cancer is it could be detected through family history. Is that correct?
Well, the higher risk is if you have a family history of ovarian cancer or a genetic predisposition, which comes through the family history, yes.
Okay. Now, for women, of course, we get annual exams.
Yes.
Is that something that can be picked up via our annual exam?
That's the most important thing. And one of the things that has been going around lately is that for a pap smear, which is a screen for cervical cancer,
okay,
if you're low risk or HPV negative, you can get a pap smear every 3 years.
Okay.
Well, that's fine.
Mm-hmm.
But for ovarian cancer, you still need to have your annual exam, your well woman exam with the doctor. The only way to pick up ovarian cancer early is an enlarged ovary, which would be found on your regular pelvic exam, the bimanual part of the pelvic exam. And so there are many women now who for cervical cancer can be screened every 3 years, but for ovarian and uterine, you still need to have a screen on an annual basis.
Now, just say a patient is diagnosed with ovarian cancer. What are their next steps?
Well, usually there's a suspicion of ovarian cancer, okay, either due to the change of the abdomen, having pain, or seeing it on an ultrasound, a suspicion that it may be there. Then you would either have one of two things that you would do. There's a procedure called a paracentesis, where they just place a needle into the abdomen and take off some of the fluid, mm-hmm, that collects there, and they can check that for cancer cells and get a good idea. The other would be either a CT-directed biopsy of it specifically, or a laparoscopy to look inside and either do a biopsy. Usually, the laparoscopy is done, you can see the tumor, take the biopsy and confirm that at the time of the procedure, mm-hmm, and then go ahead and do the surgery at that time.
Okay.
And that surgery should be performed by a gynecologic oncologist.
Dr. Bailey, is there anything that we can do to decrease the risk of ovarian cancer?
Well, that's a good question, and yes, there are. Believe it or not, taking birth control pills decreases your risk of ovarian cancer.
Really?
If you've taken them for more than 5 years and up to 9 years, there's as much as a 60% decrease in ovarian cancer, which is, that's a big change.
Sure.
The other thing is if you've had a tubal ligation for sterilization, that decreases at about 30%. And if you've actually had the fallopian tubes removed, either for a tubal pregnancy or some people when they're having a sterilization procedure done now, they take out the whole tube, that decreases your risk of ovarian cancer by 60%. One of the other things that you can do to decrease ovarian cancer is have a baby. If you've had a baby, your chance of having ovarian cancer reduces 40% with the first one and 14% more with each subsequent pregnancy.
Dr. Bailey, thank you so much for answering these important questions and just providing general knowledge about ovarian cancer. Thank you so much.
Well, we appreciate your concern and getting the word out to our constituents, our patients, and hopefully we can make a bit of an impact.